Welcome to the Grow Senior Care Podcast. Forget about being average. We're here to redefine what's possible in both your business and your life. Get fired up because we're here to help you simplify your life, grow your business with less hassle, and love what you do. Now, here's your host, Jeremy Fuller from Grow Senior Care Marketing.
Hey, this is Jeremy with Grow Senior Care Marketing, and I'm so excited today to have our special guest, Sarah Barker, with us with Senior Care Sales Solutions, right?
Yes,
Okay.
Senior Care
Awesome.
Sales
Got the names right. There's so, in the senior care world, it's always like senior care or something. It's like, did I get the name right? So we're so excited to have Sarah with us today. She's going to bring some really insightful tips to this episode. Some of those things that you're going to be hearing about today is what is holding back home care agencies from growing, but not only growing, but growing without pain, right? A lot of people hearing that, I don't want to grow. Ugh, when I think about growing, I don't want to. Okay, so we're going to be talking about how you can grow without pain, right? So really, really interesting episode. Stay tuned, stay plugged in, and get ready for some growth.
Thank you so much, Jeremy. I'm so excited to be here and appreciate the opportunity.
Awesome. So Sarah, let's just, for our listeners, our viewers on YouTube, let's just jump into just really quickly who you are and, how did you get into home care?
That's a great question. So when we were talking a minute ago, I asked if it was okay if I said that it happened by accident. We laughed, but that's actually the truth. I fell into home care. I have a military background, and then I've sold advertising, payroll, and in 2008, I got out of the military, the reserves, and like you hear about soldiers going through this identity crisis, I found myself struggling with that. And an estate planning attorney I knew at the time sent me a job posting for the first home care business development position that I received, and so the owner knew the attorney and took a chance on me. And so in 2012, I sort of fell into the senior care industry, was always a business developer. And then in 2020, I started my own company, Connect Our Elders, which is a referral agency. But shortly after that, I was asked by my former home care employer if I would consider doing consulting. So this is where, right, we're here today to talk about those things. He wanted to hire business developers, wanted me to onboard them, train them, and coach them. And so I said, well, let me think about it. And after thinking about it, I realized I could take military principles of how we train soldiers to accomplish missions and combine it with senior care industry knowledge. And that's when I created the Senior Care Sales Solutions Academy. So I started launching these academies. And then from that, agencies started asking me if I could work one-on-one with them. So that's where the Connect Forward training program came alive. And so the main things are an immersive academy, all things marketing, business development, sales focused on getting private pay clients. And then there's the ongoing coaching, which is really, I'm doing outsource sales management for a bunch of different agencies, all different sizes.
That's awesome. So I know, just personally, just from knowing you over the years, kind of the thing that really kind of sets you apart is that you had, when you were talking about it a little bit on kind of how you got started, is that, there was this home care agency, you came on board on their sales team, you started building these systems. Is it okay that we share some of those numbers? Because I know those numbers personally, and they were like shockingly good kind of compared to the industry average on kind of what, say, a marketer is typically bringing in. And then you were bringing not only that in yourself, but also building team members doing those numbers better statistically. So is that something that you mind sharing with the audience, or is that something that's kind of personal? They need to reach out, find that out.
Oh, sure. So if what we're talking about, so much of what I do goes back to what's ingrained in us as soldiers, right? And how do we build people, right? And so it's through the military believes strongly in servant leadership, right? So it's not about coming in and being a dictator. And I think what makes it possible for me to build these home care agency business developers is the approach of I'm here to partner with you in this journey. There's going to be times where you're not going to like me because I'm going to push you and it's going to feel uncomfortable. But if you trust me, it's for your own benefit. And on the other side of that is where we're getting that advancement and that growth. And so, if you're talking about numbers, I mean, I have so many different clients to tell you all the different numbers because they're at different phases. But I can tell you, if you take a brand new agency business developer with zero experience, I fully expect for them to be producing within the first 90 days. And then at 6 months, I'm expecting that they have hit their stride, right? And it's all uphill from there. But typically, somebody's not producing anything in the first 90 days. That's a red flag.
Okay. Now, what does that mean producing to you? Because everybody has their different KPIs on what that would mean. So what does it mean when you say producing?
Well, see, there's a bunch of different factors, right? Because if it's somebody that has been hired and they're coming to you, and I'm speaking to the owners now, if they're saying, I want X amount in a salary and here's what I want my comp plan to be because I'm experienced, I'm coming to you with the network. By the way, trust but verify. Okay. So here's a little tip. If somebody says that they're coming to you with a network of people, it's not about them just listing off referral source accounts because it's not the brick and mortar building that refers to you. It's the people in the building. So who do they actually know? And if they have very deep relationships, they should be comfortable giving you 2 or 3 of their referral sources for you to call and verify, right? That those sources would follow over because if they have deep relationships, they're not afraid of those referral sources leaving. So, somebody that's experienced, I expect for them to produce a whole lot more in the 90 days versus someone that's just starting out. So, for example, a marketer with zero experience within that first 90 days, I'm expecting for them to be producing at least $12,000 in weekly revenue. And that's somebody with no experience within that first 90 days in weekly revenue.
Got it. What does that look like with care hours typically?
I'd have to pull up the spreadsheet
Okay.
to tell you the exact numbers.
And I guess that also changes with what their hourly billables are. That could be dramatic. I've talked to some agencies charging like $78 an hour and some other agencies charging $48. So that could be dramatically different,
Right.
Okay. So let's get into some typical problems now holding back some home care agencies. I know you listed a few things with me earlier. So I know time management was one of those things. I don't typically think about that when I'm, talking to home care agencies. Usually, and I don't know if an owner even thinks about that. Typically, you're looking at things like, well, referral sources aren't delivered, right? So talk a little bit about the time management and how that might be holding back a home care agency owner.
Time management is key. Okay. So especially if it's the agency owner also being the business developer, it's even more crucial. So
and that's pretty common.
Yeah. If you can manage your time, you can manage your life, you get results. Okay. So the first key, and I learned this the hard way because I can think back in my first year or two, even I struggled with it. I would be in North County, San Diego, and then I'd be in South County. I got to go back to North County now. And so you have home care business developers zigzagging all over their territory and really wasting hours each day of just windshield time. Okay. So the first thing that a business developer needs to do, or the owner, whoever is doing the business development, owner, or you've hired someone, divide your territory into sectors. Okay. So whether you want to say northeast, southwest, or maybe you have a high concentration of referral sources in the north, so you've got 2 sectors for north. Okay. But after you have your sectors, most of my clients are doing it by town. Okay. So like in San Diego County, somebody might put Del Mar, Encinitas, Solana Beach, right, as a sector. You got 5 days in the week. Okay. So you should have 5 sectors. Once you have the sectors, it's really as simple as putting the referral source account into the appropriate sector, and then we assign it a relationship status. And I won't go into that. That's more of a reach out to me and I'll do a demo with you. But a relationship status, because that dictates the frequency. For example, if it's a skilled nursing facility in a hospital and we've determined that, right, we have private pay opportunity, best practice weekly visit. But if you try to see a wealth manager on a weekly basis, they're going to think you're a stalker. So, right. But so that's just one tip with the time management. And that's like that time management as it relates to your territory. But we know in home care, right, we got to be fluid sometimes. So if I'm intending on being in my sector on Monday, we'll call it sector 1 on Monday, but I get a consultation and the family can only do the consultation on Monday, but they live in sector 2, that's fine. I'll do sector 2 on Monday and I'll
Yeah.
right? It's easy as that.
But I think another thing too, and it's not so much about time management too, it's before, I think a lot of newer home care agencies, even home care agencies that's maybe around $1 million to $2 million, they don't really know who refers in their town or their cities. And so they're going out trying to build these relationships and they have no idea if they refer out for private pay, And so it's like, why even spend that time? Me and my business partner, as we're creating our list, we call, confirm, and talk to the right person first. And we don't just always take their word for it. We might ask somebody that also might service in a different angle, that same facility, to see, because sometimes when you call, you might get the wrong answer, but knowing, so that way we're not wasting time in these sectors.
I 100% agree, right? So this will go into doing our due diligence up front. Now, there will be times where you're calling and you're trying to do some pre-qualification, and nobody's calling you back and nobody's responding to your email. So, we need to, and I think for owners listening, when you're hiring a business developer, really emphasize the fact that this is an outside sales job, right? In order to get results, you have to be what I call forward facing, going out, we can call it pounding the pavement, knocking on doors, but they have to be face to face. So, but to your point, I do agree. It's very worthwhile to take the time to do research into these accounts and pre-qualify. And I love what you said, Jeremy, about if you already know somebody in your market who's also calling on those accounts, leverage that relationship, ask them what they know about that account, and also utilize websites like Medicare.gov, SNF. I think it's .gov, but there's various websites. And if anybody wants a list of those websites, let me know, and I'd be happy to send.
I'll be one. I'll put my hand up for that.
Yeah, I'll send that to you. We can find a lot of data that serves as pre-qualification. Okay,
right.
But then I do always suggest still go out there. Trust the data, but verify it. So in person. And then that's part of the pre-call planning.
And I guess that kind of goes into the next question, kind of holding back home care agencies, communication, right? So if we're doing that to communicate before we go out, you have on here no communication with the team. So kind of talk a little bit about that.
Usually depending on how the agency has chosen to do their assessment process or consultation. Are you having the business developer just establish and nurture accounts and they don't do intakes and they don't do assessments and you have somebody else doing it? If you have somebody else doing the intakes and the assessments, we have got to ensure that there is a standard operating procedure about how the communication happens between the internal team and the external team, because that business developer needs the updates on where that prospective client is in every phase, one, so they don't get blindsided by the referral source, but that is fuel to have continued conversations and build the relationship with the referral partner.
Can I just add to that? I'm not going to say who, but for those of you listening, Sarah's, as you can see, very good with the face-to-face sales and marketing side of the home care side. My expertise, 20 years in digital marketing, right? And we exclusively now work only with home care agencies for SEO, Google Ads, digital ads. So I had a conversation with one of our clients. Speaking of this communication, I think it kind of aligns with what you're talking about here. We were getting calls for them, but the owner was being told from his office staff they weren't getting calls. So then he called me and said he's not getting calls. So we go and we look at our KPIs. We measure everything that we do. There are calls. And the office staff, they're answering the phone, and I'm going to try to mimic the tone and without even over, exaggerating just exactly how this went down on the call recording. But this is what they said. I'll say company name instead of their name. But I'm going to match the tone and the speed at how they did it. So a call comes in, they don't know anything about this company from Google, right? Now, let's say this was a referral source. Let's say somebody's built up a relationship and they're like, sure. And then they call the office, set up something, and this is how your team answers the phone. This is how they did it. Company name. And I was listening to that call, and the person was like, you could hear on the other end, they were kind of taken aback. And they have no loyalty to this company. They came from Google ads. They're looking at other companies that's going to take care of their parents. And they hear company name, and then I heard another call. The person, it was a different team member. They answered the phone. I can't say their name, but I'll use your name, Sarah. They said, this is Sarah.
There are certain things that when it comes to growing, an agency, that I will never back down from towing the line on certain things. I strongly believe that every single person in that agency, like administrative staff, and then of course the business development team, should be able to do an effective intake call, and one from an emotional intelligence perspective. These people, by the time that they've gotten to these agencies, it's not as if they just started struggling right before they called. They oftentimes struggling for years. We've got that opportunity to establish emotional connection and advance them to the next step, which is the assessment. Because here's the thing, we're not helping them until we get care in place. And it starts with that first intake call. So it is super important. And what I would suggest, Jeremy, thank you for sharing those examples. Have everybody in your office answer the phone in the same exact way. Thank you for calling Connect Our Elders. How may I help you today? Okay.
Yeah.
Or whatever it is, but it should be a standard. It's part of the brand.
And, to be fair to this company, they may have had that, but even everybody, we're not AI just yet. So we're human beings, so maybe that was the case. Maybe it just wasn't happening. And so at the end of the day, I would agree with that. I think the companies that we see actually grow with digital marketing, they do have a friendly greeting. They do answer questions in a friendly manner. And we actually see their growth because we follow up with their annual revenue and they're growing, So I'm assuming that's kind of what you're talking about when you were talking about, being there if you're a referral source, if you want to pick back up there on, then now they're going to call the office, I'm assuming, is that kind of what you were talking about?
Yeah, so I'm talking about making sure there should be standard operating procedures around communication, right? So how is the person doing the assessments? So what I would expect if I'm a business developer for home care and somebody else is doing my intakes and consultations, I want to know at every phase, okay, intake happened, they called the office, one of my referral sources referred. I want to be notified immediately so I can thank the referral source and let them know the next steps.
So what does that look like to implement something like that? And so, the topic is communication, no communication with the team, that's holding back, because if your sales team members out there creating those relationships and they have no idea, okay, now this person did refer because maybe that person is going to be in touch with the office, but maybe things go south. Well, even though if there is, SOPs there, standard operating procedure, to answer the phone that way, what if they didn't, but they did communicate so-and-so called, but we didn't actually set something up? Now they can fix that because you got that communication in place.
You have the communication, and this is why, I didn't like it when I was a business developer. I thought it was annoying, but I can definitely see the value in it now, which is doing a morning stand-up call in which the entire team is on the call. It doesn't have to be an hour long. We're talking about 15 minutes, high level. Did anything happen over the night that I need to know and be aware of so I don't get blindsided, by a referral source asking me about it? I need to know what's going on. They're trusting me, right? Did anything come in? Do we have any existing clients that have doctor's appointments in which perhaps the family would want me to tag along because I'm advocating for the client and I get to meet the doctor, right? That's where every single morning we can just understand the opportunity that we have internally that we can then utilize in our day-to-day business development.
Yeah. And that kind of goes in with the next thing holding home care agencies back is not having clear KPIs. You just kind of talk about that stand-up meeting. So those are some KPIs. Anything else, any other KPIs you feel like are super helpful to have?
So with my ongoing clients that I meet with every week, I track weekly KPIs, and I work predominantly with agency business developers. If the owner's doing the business development, I'll work with them too. But I'm tracking the number of home care hours that are added each week to the book of business, the associated revenue, number of clients, the face-to-face quality interaction. It's all about the quality conversation. It could be 5 minutes with a hospital case manager, or it could be an hour-long meeting with a wealth manager. It's about, did you learn something about the account and the person, and were you able to share about your services? Okay. Advancement in the relationship, any in-services or lunch and learns that were done, any drop-offs. And this is a good one. If you are doing business development, you should never head out into the market with the intention of doing purely a drop-off, right? If it turns into a drop-off, that means that we've struck out. Your objective is to get that face-to-face and advance the relationship, okay? But sometimes, right, we get shut down. So drop-offs, text messages with referral sources, phone calls with referral sources, emails with referral sources, referrals given, okay?
Yeah.
Referrals that came in, clients that came on, and any consultations if you have the business developer doing them. So I track all of that.
Those are good. Yeah, those are good KPIs. I have a question for you. So this wasn't in our notes that we, figured out with some good topics here. So it's, as we're talking, I have a question about, I talked to somebody recently. Nobody always cares about cookies, on these drop-offs, bring them down by the suites. Some of them actually find it annoying, especially if they're on a diet, And so one of the things that I heard that some home care agencies are doing is called CEUs, where they are bringing by like a QR code or something like that. Have you heard of anything like that? Do you implement anything like that? Something that's valuable to, say, a nurse or discharge plan or something that they need to get their CEUs?
Yes.
Here you go.
So the first agency I worked for, the very first one, we would offer continuing education to attorneys, actually, MCLEs. But I do have agencies I work with that have the ability to offer CEUs to the social workers and nurses. They tend to be the larger franchise systems.
Does that work pretty well?
It does, because they need the education, and it's a good in the door. And then, of course, then we get their contact information because they've signed up. Now we can keep following up. But if you're a smaller agency, independent agency, there are resources out there that can enable you to also offer CEUs. If you want that information, let me know, and I can send that out.
Yeah, I'm actually going to do a podcast with a company that offers that. So stay tuned on this channel if you want to hear. I'm going to do a whole interview, hopefully coming out soon. But I was just curious because it's always great to hear from boots on the ground. Versus say a company that's offering that as a resource, because they're going to be like, oh, it's always great, right? But you would have some insight there.
Right. And we want to be a solution provider, you guys. Of course, our focus is the patients, how we can help the patients, but don't forget, we also need to be the solution as to what can we offer that particular referral source? How can we make their life easier? How can we build them up in their profession? And the food thing. If you're going to give coffee or if you're going to bring treats, do something in which it forces an interaction, okay? So for example, Jeremy, wow, you must get so tired towards the end of the day. You have so many patients you're responsible for. Do you drink coffee or tea?
Yeah, I'm drinking yerba mate right now.
Do you like, so you like, let's say you like coffee, okay. So you tell me you like coffee. Do you like hot coffee or cold coffee?
Cold coffee.
Cold coffee? Okay.
Yeah.
Do you prefer Dunkin' Donuts, Starbucks, Better Buns?
Oh, I prefer from this place. It's about 30 miles from my office. I'm messing with you. But yeah, I prefer Starbucks. Yeah, that works.
Oh,
yeah.
What's your favorite drink there?
Oh, I usually like to get just plain espresso. I don't know, latte. Just a latte?
Well, I'll tell you what, Jeremy. when I have to come back here next week, because Jeremy, my boss says I got to come here every week. I'm going to bring you your favorite drink from Starbucks, right? So it's like a dance, and we got to try to have fun in what we're doing because it is a grind. And then you mentioned, don't assume that people want cookies or donuts, right? I don't like sweets. I just don't. So what I used to do, 2 of those grocery bags, in one of them, put Little Debbie's treats, put your cookies, small bags of chips. And the other, put all the little cuties, bananas, apples, oranges. And then when you're going into whatever referral source, you can make it fun. It's like, what's it going to be today? Comfort or health, and then it forces them to stop and interact with you and pick like what they want.
Very good tips. Thank you for the KPIs. I have on here as well, not diversifying their referrals. So let's cover that. And then after that, I want to get into hearing a little bit about what happens at your events and about the one-on-one coaching that you do of some teams, but not diversifying referrals. What does that mean? What does that look like?
I love this topic. This is an entire day session.
We'll have to have you back.
So when I say that I see agencies leaving opportunity for growth on the table, it's for a lot of reasons, but this one that we're talking about right here is that they don't have diversification in their referral source portfolio. So what do I mean by that? You have 3 buckets of referral sources in my mind. You've got your healthcare ecosystem bucket, hospitals, SNFs, rehabs, LTACs, senior living communities, home health, hospice, so on and so forth. Then we have our legal financial bucket, estate and trust attorneys, corporate trust officers, trust litigators, private fiduciaries, financial planners, wealth managers, long-term care insurance brokers, right? CPAs, all of those. We have our community resources bucket, Alzheimer's Association, Parkinson's Association, ALS Association. We need diversification between healthcare ecosystem, legal, financial. Healthcare, high volume, don't always know what we're going to get, right? Tend not to be as sticky, long, high hour, long lasting cases. We do get some, right? But with legal financial, lower volume of referrals per year, but very sticky cases, financially qualified, referred sooner, and sold because those advisors have advisory level influence.
And who's going to be planning an estate? Somebody that could afford private pay, that has some income they're trying to protect, once they do pass along to go to heaven eventually one day. What's amazing, Sarah, and this is off topic, human beings, it's like when we get older, I've talked to a lot of older, individuals, and it's almost like they don't want to accept the fact that human beings die. And it's part of our nature. It's a guarantee. We're going to die. Yeah. Unless Elon Musk invents something that transfers our consciousness or something, But until then, we're going to have to leave this body. And so for the people that are, more wealthy and, maybe they got an inheritance, maybe they made a killing or whatever the case may be, they're going to want to structure, right? And even if they had something beforehand, they're going to go back to their attorney and maybe tweak it or some things, And at that time, that attorney is going to know, okay, do you have this in place? You also need this in place, right? You've got that side, but what about your health?
Right. And listen, these legal financial professionals need us to help advise them because typically a financial planner is thinking that it's, $5,000 a year is what care is going to cost. And so they need us to be chiming in. And here's the beauty of legal financial referral sources. They're very loyal, right? And they're not, you don't have to meet with them at the same frequency you do with the healthcare accounts. And this is why, right, when people say, well, let's just hold off on legal financial, let's focus here. And I'm saying you can do both at the same time because you don't have to see them on a weekly basis, bi-weekly or anything like that. But they're loyal once you have the relationship. The other thing is, they just want to outsource that. They want you to be a part of the advisory team. So anything senior care related, they want to know that they can call you and you'll step up to bat, right? And you will help advise them on how to help their client and just handle it and report back to them.
Yeah, that's good. That's good. So let's transition into what happens at your events. If you could just break down maybe the top 3 things that you feel like are super important that happens when somebody comes to one of your group events and what it's called. I know you mentioned it earlier, but just one more time for our audience.
So it's called the Senior Care Sales Solutions Academy. To date, we have had 25 successful academies graduate. And the mission of the academy is to redefine the way senior care professionals serve referral partners and families. And so what you can expect from an academy, it's not just me up there teaching the whole time, right? I utilize subject matter experts, which are actual referral sources, because I could teach the students about it, which I do, but it's even better if an actual referral source can come and share, right, what they do, what their expectations are. And this is always the favorite part for the students, what not to do. And so it goes through a flow of establishing the right mindset. What is it? Why is it important what you do? And what is it that we really sell? Because it's, caregivers that help with ADLs. There's so many things that we actually sell. And then we get very heavy into the tactics, best practices for in-services, professional follow-up. I mean, there's so many topics. There is a virtual option for that. It kicks off November 7th. It's 4 4-hour sessions. And so people seem to really like it.
Awesome. So that's coming up virtually. How would somebody get to register for that? Where would they go? How do they get connected to attend that?
You can go to my website, www.seniorcaresales.com. And then if you scroll down to, the academy, you can register there or reach out to me if you have questions. I have a full PDF that has all kinds of testimonials on it that you can download from the website, or I can email it to you. Yes, Jeremy, I don't have any fancy landing pages yet. Nick is on me. I'm getting Go High Level. I swear, Nick, I am. I'm going to get it done.
That's awesome. Okay. So one-on-one coaching, I know that you've done that where you've gone in and, let's say, bigger agency with, more than, say, 2 sales team members, and you come in, clean things up, clear KPIs, clear systems. What does that look like? Tell me, what's that called? Is it the same name or is it a different program? Tell me a little bit about that.
It's the Connect Forward training program. What that looks like, it's a weekly 1-hour meeting with however many business developers that the agency has. I have some that have 1. I worked with an agency. We went from 2 to 9. I've got multiple agencies that have 4. It just depends. But the first step is that we have to organize and optimize the territory, get them organized, and then set the appropriate frequency. And then every week, right? So it's rinse and repeat, really. It's a process of ongoing education, strategy support, and accountability. So every week when those business developers meet with me, we're reviewing the territory. Who comes off because they're disqualified? Have you met somebody new? Do we have to update the relationship status? And then also the KPIs are done. And over time, I can see trends, right?
Yeah.
So for example, if I start to see a business developer has a lot of the text, emails, phone calls, drop-offs, but low face-to-faces, I usually become suspicious and say, you got to get out of bed, and you really, you need to go out in the field before 11 a.m. I look at it like a partnership, right? I'm there to serve them. And so I will source referral sources in their market. I will do my best to schedule meetings for them. I help them prepare for in-services and lunch and learns, any slide decks they need.
Awesome.
Do the research and pull it all together. And pre-call planning, that we talked about time management, organization. So also my clients, I'm very big on pre-call planning. It can seem tedious at first, but it really moves the needle. And so when I have a business developer have to start doing it, they're not usually happy with me. It takes about 3 weeks before then I start hearing, wow, I feel a lot less overwhelmed, less stressed. I feel more productive in my week. I feel more present in my conversations. I feel more prepared. I feel like I'm advancing.
That's awesome.
Just by doing pre-call planning.
Well, thank you so much, Sarah, for being on here. And if you've been listening to this and you want to get connected with her, she's given her info. There'll be some in the description. There'll be some links you can click on as well. If you're looking to get your home care agency digital marketing done right, we're happy to help you. Go out to our website, growseniorcaremarketing.com. Love to help you. So thankful that you watched this episode, listened to this episode. Have a blessed day. Peace.
Thank you.